I'm strong in faith.
Faith can move mountains. Radio Maria 91.3 FM.
The voice of truth.
And welcome to Healthier You right here on Radio Maria 91.3 FM, the voice of truth. It's a cool evening, a cool Tuesday evening, and we're glad for the weather. And it's been a long weekend, and I can't believe that the 4-day weekend is almost coming to an end. It just felt like it started yesterday. And I trust you all had a restful weekend, Saturday up until today. For some people, though, not everyone. For some people, they've had to go to work, which, well, I say is quite unfortunate. But for the rest, yeah, it's a calling. So for the rest, we've enjoyed like a 4-day weekend, and I hope you all well rested over the weekend. As usual, I'm your host. My name is Ekene, and with me in the studio is
Stephanie, and good evening to you all in Abuja and everywhere hearing us. It's been a beautiful day. Honestly, today coming to the studio is not something I really emphasize today, but what has to be done.
Yes.
You know what it is, getting up a sweet day like this, holiday, the ambience, everything was just
Everything was perfect for a good rest.
To the people.
Yeah. Stephanie, did you get your salami too?
I did though.
You did.
I have a trusted colleague.
Wow, the lucky ones.
I have a trusted colleague.
I think it's appropriate to wish our Muslim brothers a very happy Salah celebration.
Sure.
Some of us did not get the meat. We're still expecting.
You'll still get. Don't worry. By tomorrow now, you start seeing foil pepper all around, and you'll be the one who will get tired to eat meat. So.
I can't wait then. Today on our show, we'll be talking about a very important topic, and that is diabetes. According to WHO, in 2021, the number of people with diabetes rose from 108 million in 1980 to about 422 million in 2014. The prevalence has been rising more rapidly in the low and middle income countries than in the higher income countries, and unfortunately we're part of the low to and middle income countries, and so it also affects us. Between 2000 and 2016, there was a 5% increase in premature mortality from diabetes. In 2019, diabetes was the 9th leading cause of death, with an estimated 1.5 million deaths directly caused by diabetes. With these numbers, you can see why it's important for us to discuss this topic.
Okay, truthfully, diabetes is worrisome.
Yes, it is.
It is worrisome because when you see patients with it, you get to pity them. And the kind of complications that come from it, you get to pity them. So diabetes is something we have to talk about, and people have to listen. Okay, and that's why we have a guest in the studio today. Somebody who has always, anytime we call him, he's a friend of the show actually. Anytime we call him, he's always there to answer us. And with us today in the studio is a seasoned medical practitioner. He's a public health specialist, and he's been doing well in his field, really. And when it comes to talk, trust me, he's number one. When it comes to enlightening you or whatever you want to hear. So with us in the studio today is Dr. Chukwunonso Obi. He's a doctor with the National Judicial Institute Clinic, and he's a public health specialist. Dr. Obi, please can we meet you?
Good evening, listeners. Good evening, Nigerians, and I want to also join the presenters to say Barakah Salah to our Muslim faithfuls this season. I'm also still expecting some more rams. I've had some, but more still.
Again, the lucky ones.
Yeah, sure.
Okay, so our line to be open. Okay, so our line again remains 081 084 475 18. I repeat, 081 084 475 18. You can call in, send in your SMS or your WhatsApp message. Please, we would like our listeners to send in their contributions. Today's topic is actually a very important one, and it cuts across various fields, both to the youth, the children, and the adults. And so we want everybody to call in, send in their contributions, their questions. Trust me, doctor is ready to do justice to it. So we'll go right on a short break, and when we'll come back, we'll delve right into our topic for the day. Don't touch that dial. Welcome back to Radio Maria 91.3 FM, the voice of truth. And the program again is Healthier You. It's your health talk program that airs every Tuesday by 4 p.m. And I, Ekene, are always here in the studio to bring you topical issues on health, science, and environment. And today we have in the studio Dr. Bichukwu Nonso. We've introduced him earlier. He has greeted us. And we'll delve right into our topic for the day. And we'll announce our phone lines again. We want you to send in your contributions, please. 081 084 47518. I'll go again. 081 084 47518. So to you, our beautiful listeners, please call in, send in your SMS or your WhatsApp message.
So, Dr. B, are we good to go?
Yeah.
Okay. So as we said earlier, the topic of the day is diabetes. So could you kindly clinically define for us what diabetes is?
Okay, to make it as simple as possible, because this is not a clinical presentation, so to speak, what we're trying to do is to enlighten the public. Now, basically, diabetes is a chronic illness that arises due to, problems with the way our bodies process, sugar or glucose. And chronic meaning that it's not something that just develops; it takes time to, develop. So that's just a simple definition of diabetes, and in the course of the discussions, we'll get to understand it more.
It's because I know normally what we'd hear is, especially when we're younger, when you're taking a lot of sugar, they will be shouting, "Oh, diabetes, diabetes, diabetes." So, consuming a lot of sugar, does it translate automatically to diabetes? Because that's something we heard over and over
again.
Yeah, not necessarily. It's diabetes has so much to do with the body, how it processes those sugar that comes into the body. It's that is not to say that we should keep pumping in sugar into the body, but also it becomes a problem because those things that we eat eventually may increase our body weight and then predispose us to the diabetes. But basically, it's not the sugar that we introduce to the body that causes the diabetes. When the body, it loses the ability to process it well, or then perhaps when the body itself, maybe the insulin that the pancreas produces that we're going to see later, may not be enough, and the body doesn't produce it too. So generally, it has to do with the body and not what comes into it when we're talking about the cause.
Okay, I mean, at least that clarification is good.
Yeah, but this issue of taking sugar and all that. Well, we'll get to that, but people they just use it to scare you so you can control your intake really, They cannot start speaking all this in English to you. So I think that's just the layman's way of telling you, hey, that
watch
can
it.
actually be harmful to you. So just watch the way you take in sugar. They use a lot of very strong lines these days to keep us.
I mean, it kind of reminds me of when I think a friend of mine he's a pharmacist, and the patient, she was trying to explain to the patient, "Oh, you're meant to take this drug this way," and the patient was trying to ask, "Why would I take it?" She said, "I didn't have strength." I just said, "If you take it anyhow, you die." If you take it anyhow, you die.
You see why people just use a myth to just keep people up to their toes, and I think that's what they did back those days.
Yes.
Use a myth to keep people up to their toes because they don't have any scientific explanation to give you. So they just need something to tell you that this will happen if you do this.
So we're made to know during the course of the research is that diabetes are of two types. So what are the types of the different types of diabetes?
Okay, yeah, two main types, but there is a third one. So we could generally say that we have basically three types.
Okay.
There is type 1 diabetes, that some people say it's the insulin dependent, and then there's type 2 that's not insulin dependent, but basically it's type 1, type 2, and then the gestational Diabetes, gestation means that gestational, meaning that it has to do with pregnancy,
Okay.
when a woman is pregnant. So we have 1, 2, and type 3 diabetes.
Okay, could you kindly define them for us?
Now, the first type is the type 1 diabetes. Type 1, we started with 1. It's the one that some people say is the although that's not the definition, says it's insulin dependent.
Okay.
That's the one that happens. Basically, we need to understand that there is an organ in the abdomen that is called pancreas. Now, this pancreas produces a hormone, a chemical in the body called insulin. Excuse me. It is this chemical that the work of this chemical is to remove sugar from the bloodstream. When we eat, sugar or glucose goes into the blood. Now, this insulin is secreted by the pancreas once the sugar comes in. The work is to move out that sugar from the blood into our cells, where it will now be used for, as energy or the daily functions we do, producing energy. So the type 1, now the insulin is important to understand that in this type 1, that the insulin is not secreted. The pancreas lacks the ability to bring out this insulin to do this work. And when that happens, the sugar that should be moved into the cells of the human body, accumulates in the bloodstream. And when you check, you realize that the sugar will always be higher than normal. So this one is the one that is seen more, in children, adolescents, and all that. It sets in early in life because of obvious reasons, And then the type 2 is the one that is seen more in adults. Most diabetes we treat are type 2 diabetes. The statistics says 90 to 95% of the diabetes is type 2 diabetes.
That's a huge percentage.
Yeah.
Yes.
Type 1 is 5 to 10%. You hardly see them actually, but of course there are people who have that too. That's for type 2, diabetes. That's the one that could happen, because of lifestyle that we have now.
Yeah.
People are getting obese because of the things we eat and all that. So you could see that the pancreas in this situation may be producing lesser quantity of insulin that is expected or is required, or that the body starts having resistance to this insulin that is secreted, that it won't do the work as it should do. So by so doing, of course, you start seeing sugar accumulating in the bloodstream, and when you check, the value becomes higher than normal. Then the third one is the one that is called gestational. Is the one that is seen in pregnancy. Most of the times, about maybe between 4 and 28 weeks of pregnancy, that we make those diagnoses. Of course, people who have predisposition, family history of that, or someone who has had gestational diabetes in previous pregnancies, we tend to possibly make that diagnosis early. But this one has to do, with pregnancy. That's the type 3.
Okay, we have just heard the type 1, the type 2, and the type 3. And then often at times you hear people say, my papa no get sugar problem. My mama no get sugar problem. And I think doctor has just explained it that type 2, you see most people develop it. Most people tend to not bother because they feel it's not in their lineage. My papa no sick. Somebody started it, and that's why we are. It's true.
Yeah.
That's why we are reminding people again. Your father or your mother may not have been diagnosed of it, may have had it and you wouldn't even know.
No.
Sure.
Okay, and may not have shown it or had it or something, but that doesn't mean that you, because of your lifestyle, from what doctor said, will not be predisposed.
So their parents didn't live old enough to that.
So even there's something that just happened on the way, and the parents just went, and you wouldn't even know that the person had diabetes. And doctor, when you're talking about the types, when you talked about type 1, type 2, gestational, you talked about these predisposing factors. You said there are some things that will make insulin not be produced. There are some things that will make it not act, and then make the sugar, the glucose just deposit in the bloodstream. So can we know what are those things that could predispose us
Okay.
to have it our insulin not active, or make the sugar remain there, not break down, and all that.
Okay, that's fine. Now again, we'll take it from 1 to 3.
Okay.
Now, for type 1 diabetes is the one that some people say is autoimmune. You know, the cells, the body starts fighting its own cells in this situation, so sometimes for unknown reasons. You know, so if no, we are not really so sure of what could cause that type 1, because somebody could be born and you notice it. Now, but predisposing factor is seen more in younger people. You know, if there is family history of such, it could happen. Now, for type 2, like I said, is the one that you have 90 to 95% of the population, the one you see more in adults. Now, there is a family history of diabetes. This is where you begin to see that. You know, when people are, as we grow older, the tendency 25 years and above is there. Now, people who are obese, you know, it's a predisposing factor for diabetes. The gestational diabetes, if it has happened before, for example, a woman who has had previous history of gestational diabetes has chance of having again in subsequent pregnancies. If a woman has delivered a baby of maybe more than 4 kilograms, you know, what they say 4 point something pounds, chances are that the person, you know, maybe, you know, those are predisposing factors that we could also talk about. And of course, an obese mom, you know, also has chance of, you know, having diabetes. So some of these things are predisposing factors for, you know, diabetes.
Like Doc, we've talked about gestational.
Yeah.
Now, we know it comes when the woman is pregnant. Now, after the pregnancy, does the diabetes just go away, or the person at that time has already developed the disease?
Yeah, that's a very important question. You know, unlike the other two, the type 1 and type 2, now gestational diabetes, we expect that after delivery that the woman recovers.
Okay.
But again, like I said in the predisposing factors, previous history of gestational diabetes, some may, you know, having had gestational diabetes is a predisposing factor.
So now
So
have
it
it.
is of someone to develop type 2 diabetes.
Okay.
But ideally, you know, it's called gestational. It's limited to gestation period. So once the baby comes out, which is what is causing the problem, and the stress is over, we expect that the patient should have normal glucose.
So could it be that, like you said, could it be that stress is one of these predisposing factors? Like, because, like you said, the problems of pregnancy, the change and everything, could it be that stress is part of it?
Yeah, we may not start discussing the mechanism of you know, gestational diabetes, you know, in this context. However, yes, the stress of pregnancy is a burden on the system.
Burden, yes.
So that's the gestation we're talking about. Everything that happens at that period, you know, the weights that could predispose the woman to that gestational diabetes.
Okay.
So we're talking about diabetes now. We know that diabetes comes with like a lot of complications over time. So what are some of these complications of diabetes?
Okay, I think we should just talk about the symptoms first, so that we know how you have started it. Then we now know how complicated it can be.
Yeah, I think that's good.
Let's get to know what will you
the
show.
complication
So that
is
we'll now know.
important because you know, but I think it's good that you know,
Let's know what is showing that you have it, so that you will now know what can come out from it.
Okay. Now for the symptoms and signs. Now, symptoms are the things the patient tells the doctor, the things they come with. That is what I feel. This will happen and all that. The signs are the things we see when we examine them. And for the symptoms, they come. Most of them will tell you that what we call the three-piece polydipsia, polyphagia, phagia, polyuria. Somebody begins to urinate too frequently. Now they have excessive thirst to take water. They are drinking water and they're still thirsty. And someone is eating so much and still losing weight, despite taking a lot of food. And then in the night you discover that someone the patient is going out to urinate too frequently. Now these are some of the symptoms they come with. They tell you that they're having blurred vision. Someone who could see clearly normally, and that's start having blurring of vision. Then some complain that they are getting excessively tired, because this is because of course the sugar is not going into the cells to give them energy. Some they tell you that they're beginning to have too many infections, or they're having wounds that are not healing. Now for the signs that we see, of course patients come and you look at them, see that the skin becomes unusually dry. You check the blood sugar and see that it's off, so over the roof. You are treating a patient that has wound, and everything you're doing, see that this wound is not healing. So these are some of the symptoms and the signs that we see in patients that have diabetes. But the one that brings people more is this thing about drinking too much water. They wake up too frequently to urinate.
Okay, that's a good one. At least we know what would be predisposed to, what signs we show that that they cause to come to the hospital and get worried that okay, am I having diabetes and all that.
So now back to the initial question. So these symptoms, after having talked about the symptoms, so the complications of diabetes. So what are some of these complications that you notice over time?
Okay, let's take it from up and we'll go down. Now, there's increased risk of cerebrovascular issues, stroke and all that. Then the diabetes is one of the commonest causes of the cataract to see, retinopathies, even eventually the blindness that would see a lot.
Oh wow,
in a lot
that's
of patients.
serious.
Yeah, sure. Of course, heart diseases, diabetes, one of the causes. Then the one that is very important is the chronic kidney diseases, kidney failures that we see a lot. Diabetes is the main culprit in a lot of patients.
Because these days I'm noticing we're having a lot of
kidney cases.
Yes.
A lot.
Diabetes is one of the causes, because on the average, the studies say we diagnose about maybe 1.5 million cases in Nigeria, annually. So that's this is
become a lot.
issues
Like
of
when you hear about
kidney
10
disease
people who
also.
and then you're asking what's the problem, you're hearing kidney disease. A lot of people are in dialysis. It's become a very big issue.
Exactly. And then issues of neuropathies, that you see that people, there is numbness, consistent numbness, and then people have small wounds in the extremities, especially the legs, and they don't know, because diabetes affect those nerve endings. Because it's the nerves that we have that protect us. A small wound, the body tells you, oh, there's pains here, that there's a problem. But for people who are diabetic, some of them don't feel those things again. So they may have small wounds at the extremities, and the wound continues to worsen without their notice. And of course, the tiny blood vessels at those extremities too also affected by diabetes, and then those could lead to gangrene. But diabetes is one of the commonest causes of amputations that we see in hospitals and in recent times.
What of this sores, ulcers? You see that?
Yes, like I said,
Yes.
wounds in those extremities. When those wounds are there and they don't know they're infected, and that's why
So
you
it
start
could be at
seeing sores.
any part of your body, or just those.
Just at the extremities.
So every part of the body,
Okay.
because one of the things that happens is that the white blood cells, that goes to fight infections at different parts of the body. What we see, what medicine calls lazy leukocyte syndrome. The white blood cells become lazy, so to speak, in lay terms, that where they should go to where there are wounds, where there are infections, to fight those infections, and they are not going in there. They are slow. So you see that wounds continue to expand wherever they are. It becomes difficult to heal, and that's why when we're managing wounds in patients, as much as possible, the first thing is to make sure that the blood sugar level is normal if the wound must heal.
Well, that's it. That's a lot to take in for now. We'll be going on a short break. When we come back, we'll delve further more into the topic of the day, which is diabetes, with Dr. Obi in the studio. Don't touch that dial.
Welcome back to Radio Maria 91.3 FM, the voice of truth, and the show again is Healthier You. Today we've been talking about diabetes, and with us in the studio, he has been doing justice to the topic, is Dr. Obi Chukwunonso. He's a public health specialist. He's a seasoned medical practitioner with the National Judicial Institute Clinic. So far, he has defined what diabetes is to us, and he has also told us the types of diabetes. So we have the type 1, type 2, and the gestational. He has told us the predisposing factors and the developments that come, and then also the symptoms and complications. He has also told us that what are the symptoms when you do frequent urination, the 3 P's, you can't sleep well, and all that. So, Doc, we've done a whole lot. Okay, before we continue, I think we should just announce the phone lines again. Is it that people like their house is sleeping? It's like people like their house is sleeping.
It's a holiday.
It's a holiday. We'll give it to them. But we'll just announce it again for those of us who are listening. Please, let's call in, send in our contributions. It's a very important topic, and I think from my experiences, others will also learn from it. So I'll announce the phone lines again: 081 084 475 18, 081 084 475 18. Please call in, send in your SMS and your WhatsApp messages.
I said that the diagnosis starts from the symptoms the patient presents with. When the patient comes, when people come in and they are passing urine more frequently than they used to, they wake up too many times in the night to urinate, something unusual that's is a cause for concern for them. That people are eating so much yet are losing weight. Then people have blood vision, and they have wounds, and it's not healing. So we start thinking that this could be diabetes. Now, for laboratory investigations, mostly in our environment, there are 2 major tests we do for diabetes. Although there are other ones, but majorly we do the fasting or random blood sugar. There's a glycated hemoglobin test, that's also done, A1C. There's a hemoglobin that is always strongly linked to glucose that we check the values to. Then there's another test we call postprandial glucose, 1 hour, 2 hours, and all that's postprandial after eating. We use that to also check. There's an oral glucose tolerance test that is also done, especially when in pregnancy. To all these tests will eventually tell us if the value is abnormal, or people are at pre-diabetic levels, or if it's normal.
What of the one that ants gather? I'm coming to the local aspects now. People diagnose like that, they will tell you urinate on the ground and if ants gathered. That's our local way.
Yeah, of course. So obviously, because there is sugar in it, that's
it's possible.
It may not be documented as what
scientific
but really,
evidence.
yes, you really when ants gather around urine, chances are that perhaps, there's sugar in that urine.
It's
So
actually much.
that could also tell the patient that okay, maybe something
Some
is
actually
wrong
go as far
with
as
me.
testing their urine.
So when
Okay.
you talked about the value, so what is the normal range that we're looking at when we're testing for diabetes?
Okay, majorly in our environment for the fasting blood sugar, there are little differences between one lab and the other, but generally, let's just say 3.5 to 6.5 millimoles per liter is what we take as normal. And then between that 6.6 to 6.9 is the pre-diabetes, or sometimes people say it's impaired glucose. But once the value of the fasting blood sugar value is 7 millimoles per liter and above, the person is said to be diabetic. And of course, this fasting blood sugar means that the person does have fasted over the night. As almost say, some people say within 8 to 12 hours fast, and then you come to the hospital the next day to check this blood sugar.
Okay, exactly. Is it that, of course, when you're diagnosed, I'm sure it's not just the blood sugar test of once that the patient would. Is it something that you do repeatedly, or you do it once and then the doctor says this is what you have, or you have to you do the first one and say okay, let's watch it or something, or do you just conclude
Just
okay, yes,
of one
this
test.
patient has it?
Okay.
You know why I ask this question? So that those people out there would
With the
With
machines at home.
advice.
Yeah, I can understand. Remember that what I said now, the one I discussed is the fasting blood sugar,
yes.
which in our environment most of the time we use as our gold standard. Of
Yeah.
course, the glycated hemoglobin is very, very important, as for diagnosis too. But generally around here, almost always is fasting blood sugar. Now, the fasting blood sugar, if we see that value of 3.5 to 6.5, the person is normal. Just one test. Between that 6.6 and 6.9 is pre-diabetes. But 7 millimoles per liter, one test, where the rule says this person is diabetic. So you don't need to, except when you feel that maybe this person has not fasted, or there are reasons you may think that you need to get a second opinion. Aside that, this the value of more than 7 millimoles per liter for fasting blood sugar is diabetes.
Okay, we're actually saying this because a lot of people have glucometer in their houses right now.
Yeah, very encouraged.
And they don't feel the need to come to the hospital because they check it on a daily or weekly basis because they want to monitor their sugar level. Now, why we're saying this is that once you see that there is a raised level, please come to the hospital to check. Yes, at times it may not be, maybe it's machine malfunction or strip malfunction or something, but once you see that it's a little elevated, please just find your way to the hospital so that you can be properly diagnosed. But some people will just think, oh no, let me watch it for 1 month. Yeah, some people will do that. Some people add their own doctors and their own, they'll watch it and no, let me just keep watching it. And then you keep seeing it progress and you're still watching it. Okay, so doctor is saying that once you notice an elevated level, do find your way to the hospital.
So for one that is predisposed to the development of diabetes, what are some precautionary measures that such a person should take?
Okay, the type 2 diabetes, that, like I said, is the one that you see more, in a lot of adults, and incidence and the prevalence of type 2 diabetes, like you read out, in the introduction, you could see that progressively, more and more people are getting diabetic. So the issue is our lifestyle, basically. One of the things we encourage so much is lifestyle modification, especially for people who are predisposed. Maybe there's a family history, it could delay it, or most of the time onset, it may not even the person may not develop it, or you may delay it. So basically, we encourage that people should make sure they don't.
You see on this lifestyle, I'm not going to talk because you see on this lifestyle issue, I will not talk. Don't look at me because
increase body weight is a major issue. Once the body mass index is going high, obesity, because what happens is that it causes insulin resistance. That insulin that should normally, that quantity should do the job, but because there's a resistance to it because of obesity, chances are that the blood sugar starts increasing. We encourage people to get involved in be active, do things that keep them active. If I know that urban professionals, chances of living sedentary lifestyle because of the kind of work most of us do is there very high. We drive around and all that. So, but what I encourage people is, as much as possible, find a way to increase physical activities. If you live, if your office is in a place where, if your office is in a building that has lift, you may decide to just walk or take the stairs up and down. Now, if the car park, if there are several car parks, and the one that is farther away from the office also a car park,
why not
encourage
use
that
it?
you use that one, so that it could help you maybe take 5 minutes walk to the office instead of driving to for a break to take lunch and all that while in the office. You could so I was talking about making sure that we engage in physical activities that would make sure we don't increase our weight as much as possible. Obesity is a problem, one of the reasons that the incidence and prevalence of type 2 diabetes is high in our population. Now, the things we eat, we encourage that people do more of, much as it should be a balanced diet, but we discourage food that have a lot of carbohydrates, so much calories that will accumulate and eventually increase our weight. And I was also emphasizing exercise, making sure that we avoid sedentary lifestyle. If we do that and our body mass index is within the normal range, chances of developing diabetes reduces. So basically, the food, the kind of food we eat, exercise, and making sure that we engage in physical activities.
Okay, Doc. Some of our callers have been trying to call in. They've sent in text messages, so maybe we'll just deal with the text messages before we continue. Okay, we have from Amos in Kuje. He says, "Thank you, Doc. Please, how do we manage or treat diabetes, especially when one is having frequent urination before it becomes chronic?"
Okay, thank you, Amos, for the contribution.
Okay, I think I should just read the next message because it's also in line with the same urinating. Okay, so we have Clement from Niger State, and he says, "Good evening, doctor. Just to find out whether urinating up to 3 times in the night, though not all nights, is the sign of diabetes."
Okay. We'll start with the signs. The 3 times in one night is a lot, because most of the time, by WHO standards, the average adult sleep for 6 to 8 hours. So within 8 hours, once is more than twice. In fact, urinating once, because you go to bed, say 3-4 hours, you wake up to pass urine. So we don't expect you to wake up again. So, but once it's more than 2 times, the person needs to, see a doctor and check. However, and we also need to know that the amount of water, the water intake before we go to bed contributes to, our waking up to urinate. So it's important that we also look at that, especially when it's not every night that the person,
What
you
of
know,
cold
you know,
nights, weather too.
yeah, weather, the amount of water level, the amount of vapor in the air, humidity.
Yeah.
So that's also something that contributes to. But generally, if for any reason someone passes urine in the night for up to 3 times, it needs to go to the hospital and check for diabetes. Sometimes may not be diabetes, may just be urinary tract infection, but that's a story, another
For another day.
another discussion. Then the other thing is about treatment.
Okay.
Now, if the diagnosis is not made, for
I think
example,
that will just move us
That will
to
just
the
move
next
us to the next question. Then the treatment.
Because-
okay, when we answer Emma's
Because
stage,
Exactly.
yes,
So-
Emma's question
okay.
is treatment actually.
Okay,
So
okay,
that's where we are
that's
going
beautiful. Now, to treatment is twofold. Now, for one, so some first is that someone who has the type 1 diabetes, the treatment is insulin. The person must live on insulin, daily insulin injection.
to. Okay, those people you see injecting insulin.
Beautiful. That the pancreas, that organ in the abdomen that we talked about at the beginning, does not secrete insulin. So we need to bring in external insulin to
help the metabolism.
to do that job that the one from within the body should do. So that's the treatment. Now for
Now, doc, please let me dwell on that taking of insulin.
yeah.
You find out at times some patients may not adhere to the times at which they are supposed to take that insulin, because I think there's a time for insulin to be taken, either before or after food.
Yeah, the thing is, every medication, every drug has a prescription,
Yes.
and the prescription talks about the dose,
The
the
time.
time. So it's important that we stay for the timing of the insulin injection, whatever the prescription is. The route of administration, the time, how many doses to be taken, and all that should be strictly adhered to. It's
to.
important. It's important. So the then for type 2 diabetes, the treatment really. Now let me talk about pre-diabetes, because if we sometimes say it's borderline diabetes, that the person is almost there, but no for example, with between 6.6 and 6.9 millimoles per liter. Now, what we encourage is conservative treatment,
Okay.
and we have seen people who, by conservative treatment, lifestyle modification, have seen that the blood sugar drops.
Drugs.
You don't necessarily need to take drugs.
Drugs for that.
Yes, when it's just about the borderline, so to speak. So if one can stick to it, reduce weight, reduce intake of things that have a lot of calories, carbohydrates, and all that, increase exercise activities that would increase insulin sensitivity, because that's one of the things exercise also does, that the little we have there, the body becomes more sensitive to it, as opposed to to obesity. So if that happens, the person may not need to come to us to receive tablets. However,
the one they don't want to hear.
However, so the other one is medication. Now, when conservative management fails, tablets, especially once you have 7 millimoles per liter and above, so we give tablets to control, the blood sugar. And what we see here is the body, like we defined at the beginning, the body does not secrete enough insulin. So it's just like we're assisting the body with some medications to make sure that the sugar in the blood is sent to the cells where they are needed for the person's activity and energy. So by and large, then of course, if people start taking drugs, it's good that we know that it's a chronic illness that has no cure. So once people start taking medications for life, just like hypertension, so sometimes you see patients coming out, will I have to continue this and all of that?
How long?
So what we encourage people who have been diagnosed, diabetic, is that they take it as one of the things they do every day. It's a mind thing. We eat every day, we pray every day, we talk every day, we move around every day, we go to work every day. So just that one tablet that we take once in a day or twice in a day, or a lot of time once in a day, to just keep our blood sugar. Remember that the essence of that control is to make sure that the complications don't set in. And of course, insulin for some people who have type 2 diabetes, depending on the level of, sometimes it's so high that you need to, also prescribe insulin at the adequate dose. But lastly, for people who have wounds, serious wounds that refuse to heal, once we notice the wound, we convert immediately. So for people who have wound and they go to the hospital, the doctor is saying, you now start taking insulin injections. Some will refuse that they are taking tablets. At that time, you need to take the insulin to control the blood sugar, because the drug may not likely, be effective. And for the wound to heal, the blood sugar level must be normal.
On this treatment issue, I have a lot of concern, because the years past, times past, it has been a big issue. The issue of a lot of supplements, a lot of herbal drinks, a lot of teas. Everybody talking about how it controls diabetes. A lot of agbo, a lot of herbs, leaves, and all that. Doctor, please, can you just say one or two things about this? I know we're running short of time, but it has become a thing of concern, because you see a lot of 3/4 of the people who are actually diabetic, especially diabetic, they have a lot of prescriptions from everywhere, and they take all together. They take their morning orthodox medicine. Immediately after that medicine, there's a tea somewhere prescribed by an aunt or a friend.
Yeah, really, I'm happy that you brought up this issue, because sometimes it's some of the issues we see with patients. Sometimes they come with packs of them.
Yes.
That you should give approval to the ones you think will fly. The
good ones even bring to you.
Exactly, that's what I was about to say. The good ones even bring.
Good ones bring to you to check.
Exactly. The truth is that as much as possible, we discourage all the supplements as much as possible. And that is not to say that there may not be good ones, but as much as possible, we discourage them. Now, there are certain multivitamins that the people who are diabetic could take. But as per treatment, all those herbs that they take, and the teas and the concoctions and all that, what happens is that people disturb their liver and the kidneys with some of these things. These are some of the causes of hepatitis we have in our, even chronic kidney and liver disease that eventually, people eventually have over time. So we really, is a no-no. We discourage them as much as possible. These things are very simple. That when the diagnosis is made, we could use conservative management to, when it's just maybe pre-diabetes, work on that. People would rather, buy a lot of things, spend money, than do simple things as work. The hard work, reduce your weight,
check what you eat,
check the things you eat and all that. They would rather pack those herbs than doing these
most
ones that
times
are
it's
simpler.
influence from outside room. Influence.
So really discourage them as much as possible. Save that funds, take care of your health, and then, take control of your health by the things you eat, and then exercise. You'll be fine.
I think that even answers our last question, which is, what is the healthy lifestyle to live?
Yes.
And Doc has been saying it. It's about eating healthy. Make sure you have a lot of vegetables rather than more calories of carbohydrates and sugars in your system. In this part of our world, carbohydrates is our staple food. We eat yam in the morning as boiled yam, we eat it in the afternoon as pounded yam, we eat it in the evening as fried yam.
I was talking to a patient recently from Benue. I love my Benue friends. He told me that how can you tell a TV man not to eat pounded yam?
Exactly.
We really need to watch these things.
Yes, so that's our staple food. Actually, we can't run away from it. You are eating yam, rice, and swallow. It's just for what we are saying.
And
like
even the beans, we say, it's protein.
It still
has carbohydrates in it.
Exactly, but still better.
Yes. So Doc has been saying it, the lifestyle, eat healthy, exercise can never be overemphasized. Even if you deserve to control your diabetes, at least to have a good mental health and a good physical structure. Okay, so eating healthy, exercise, do your normal regular checkups. When you know you have a lineage of somebody who has had it before, make sure you control it from even as far as when you're little. So thank you so much, Doc. Today we've talked about a lot. We've talked about what diabetes is. We've talked about type 1, type 2, gestational diabetes. For those of you listening to us, gestational diabetes is for pregnant women and all that. So we've talked about the symptoms. When you urinate frequently at night, it may not necessarily be diabetes, yes, but it's something you should get checked out. Okay, and then what are the complications? Kidney, liver is something that cannot be overemphasized. Like today, you see every now and then there's kidney failure. This person is going for dialysis and all that. Okay, this could be part of the complications that come out from diabetes, and we know how terrible it can be managing somebody with a kidney failure. Having said that, we are begging you, please watch what you eat, live healthy, really, because you need to understand that you are what you eat. You're predisposed to these diseases when you're not able to manage yourself. It's been an interesting day today, and Doc has done justice to it again, if I must say. Dr. B, as always, he has done justice to the topic as always, and want to appreciate you, Dr. B. Can you just give us a line while we try to wrap up our program, a line for our listeners to go with today on diabetes?
Yeah, but listeners, again, I want to plead with us to modify our lifestyle. That's the key word today. Once you see any of these symptoms that we've outlined today, go to the hospital and check, because once we discover these things early, can be treated, and then the complications can be prevented. Thank you.
Thank you so much, Dr. Ekene.
Thank you so much, Dr. B, for your time today. It has been a very informative session with you today. And that's our package to Healthier You, right here on Radio Maria 91.3 FM. Sorry, we'll see you again next week. Same station, same time. Do have a lovely evening. From Stephanie and I, we say
bye-bye and be good.